Toenails, much like fingernails, are often overlooked, yet they serve as important indicators of our overall health. They can provide valuable insights into your body's condition and act as visible warning signs for various underlying health issues. Paying close attention to changes in your toenails, particularly in terms of color, texture, or shape, can help you catch health problems early, potentially preventing them from worsening over time. One of the easiest ways to spot these changes is by observing the color of your toenails, as any abnormalities are often quite noticeable. Recognizing these changes promptly and understanding their possible meanings can play a crucial role in maintaining good health. By detecting issues early, you can take appropriate measures, whether it involves making lifestyle adjustments or seeking medical treatment. With this in mind, today, we will discuss 3 specific health conditions that can be identified by examining changes in your toenails. Keeping track of these changes allows you to take proactive steps toward better health. Stay positive and healthy as we explore this topic in depth. Black discoloration of the toenail. The first condition we will explore is black discoloration of the toenail. If you notice that your toenail has turned black, one of the most common causes is external trauma or bruising. This can occur when you wear shoes that are too tight, which places excessive pressure on your toes, or when your foot collides with a hard object, leading to physical damage to the nail and surrounding tissue. When the blood vessels beneath the toenail break due to trauma, it can cause a blackened appearance. This discoloration might look alarming, but in most cases, it is a temporary condition. The toenail usually goes through a natural healing process. As the nail grows and is regularly trimmed, the darkened portion will gradually move out and eventually disappear. Depending on how quickly your nails grow, this process may take several months. However, not all cases of black discoloration can be attributed to physical trauma. If your toenail turns black without any clear cause or history of injury, it could be a warning sign of a more serious health concern. One particularly concerning possibility is melanoma, a dangerous and potentially life-threatening form of skin cancer. Although melanoma is commonly associated with skin lesions, it can occasionally manifest under the toenail. When to be concerned about melanoma. Melanoma under the toenail, also known as subungual melanoma, may appear as a dark spot, streak, or stripe running vertically under the nail. Unlike trauma-related discoloration, melanoma-related changes do not fade or grow out over time. Instead, they may become larger, spread, or change shape as time goes on. One of the early symptoms caused by melanoma is this black discoloration. If you notice a black streak or dark spot under your toenail without any clear cause, it is crucial not to dismiss it. The discoloration may start small, but if it grows larger, becomes irregular in shape, or if additional spots develop, it could be an early warning sign of cancer. Prompt attention is essential. If the discoloration does not fade over time, begins to spread, or changes in shape, seeking medical advice becomes imperative. Consulting a dermatologist for an accurate diagnosis is highly recommended. The dermatologist may conduct a thorough visual examination and, if necessary, perform a biopsy or other tests to determine whether the discoloration is benign or malignant. Ignoring these changes could delay critical treatment, potentially putting your health at significant risk. Melanoma, when caught early, is much more treatable, so vigilance is key. By recognizing unusual changes in your toenail and seeking professional evaluation when needed, you can significantly improve the chances of a positive outcome. The second condition to be aware of is white discoloration of the toenail. This condition may appear as small white spots, patches, or even the entire nail turning white. Various factors can contribute to this change, including physical irritation, fungal infections, and nutritional deficiencies. Recognizing the underlying cause is important to take appropriate action and maintain toenail health. One of the most common causes of white discoloration on the toenail is physical irritation, typically caused by wearing tight or poorly fitting shoes. Shoes that press too tightly on the toes or high heels that put excessive pressure on the toenails can cause friction and damage to the nails, resulting in white spots or patches. This irritation is often temporary and may resolve as the toenail grows and the affected area moves out. To prevent such issues, it's important to choose shoes that fit comfortably and provide adequate support for the feet. However, if there is no obvious external cause for the white discoloration, it could indicate a fungal infection. Fungal infections are common, especially in warm, moist environments such as communal showers, swimming pools, or locker rooms. The fungi thrive in damp conditions and can lead to toenail discoloration, often causing white patches or a general whitening of the toenail. One specific type of fungal infection is superficial white onychomycosis, which affects the surface of the toenail. This condition causes the toenail to appear powdery white and, over time, may cause the nail to become rough, brittle, and more prone to breaking. If you suspect a fungal infection, antifungal treatments such as creams or oral medications can help resolve the issue, and it's important to act quickly to prevent the infection from worsening. In addition to fungal infections, white toenails can sometimes be a sign of a nutritional deficiency, particularly a lack of protein. Protein is vital for the growth and maintenance of healthy skin, nails, and hair. If the body is not getting enough protein, it can affect the ability to produce strong toenail cells, leading to discoloration. In more severe cases, the entire toenail may turn white and become brittle, which can make the nail more susceptible to breaking or chipping. Ensuring an adequate intake of protein-rich foods like lean meats, eggs, dairy, beans, and nuts can help support nail health and prevent these issues. To maintain healthy toenails and prevent white discoloration, it's essential to adopt a well-balanced diet rich in nutrients and practice proper foot hygiene. Regularly washing your feet and thoroughly drying them, especially between the toes, can help prevent fungal infections. Additionally, wearing breathable shoes and moisture-wicking socks can keep the feet dry and reduce the likelihood of fungal growth. Avoid walking barefoot in public places to protect your feet from possible infections. If white discoloration persists or worsens despite following these preventive measures, it's important to consult a healthcare professional. A doctor or dermatologist can evaluate your toenails and, if necessary, perform tests to identify the underlying cause. If a fungal infection or nutritional deficiency is diagnosed, appropriate treatments or dietary adjustments will be recommended to restore the health of your toenails. Taking proactive steps to monitor and address any changes in your toenails can help you maintain healthy feet and avoid more serious health concerns. The third condition involves yellow and green discoloration of the toenails. If your toenails turn yellow or green, it may be a sign of bacterial or fungal infections, both of which require attention and care. When a toenail turns yellow, it is usually due to the growth of fungus caused by moisture and the accumulation of waste materials under the nail. Fungal infections are quite common and can occur when your feet are exposed to warm, damp environments for extended periods, such as wearing sweaty socks or poorly ventilated shoes. These fungi thrive in moist conditions and can lead to discoloration and thickening of the nail. Fortunately, fungal infections are relatively easy to treat. Applying antifungal ointments or creams can help manage the condition and gradually restore the nail's natural appearance. Additionally, maintaining proper foot hygiene, including drying your feet thoroughly and wearing breathable shoes, can prevent fungal infections from recurring. On the other hand, if your toenail takes on a greenish color that resembles a layer of nail polish, it may be due to bacterial growth. This condition often occurs when bacteria, such as Pseudomonas aeruginosa, thrive in damp, humid environments. The bacteria can colonize the space under the toenail, causing it to develop a greenish tint. Unlike fungal infections, bacterial infections are often more challenging to resolve by simply applying ointments or trimming the affected nail. The bacteria can persist in the nail bed and may require professional treatment. If you notice green discoloration, it's best to consult a healthcare provider who can recommend appropriate medical treatment. In both cases, preventing these issues comes down to maintaining good foot hygiene. Make sure to keep your feet clean, dry, and well ventilated. Avoid walking barefoot in communal areas like pools and locker rooms, and regularly inspect your toenails for any unusual changes. Today, we've explored 3 health conditions that can be detected by observing changes in your toenails: black, white, and yellow or green discoloration. These visible signs can provide important clues about your health. Take a moment to check your toenails right now and monitor their condition. If you notice anything unusual, it's always best to visit a healthcare professional for an accurate diagnosis and proper treatment. If you found today's information helpful, please don't forget to subscribe, like the video, and turn on notifications. I'll be back in the next video with more valuable health information. Wishing you all a healthy and happy day ahead.